In this video, I'm going to be telling you the difference between obesity, overweight, and morbidly obese, objectively as possible. And towards the end, I'm going to give you my subjective opinions on the obesity pandemic, why you should even care about this, and how we can actually help this obesity pandemic, and what to do. And also be providing a lot of resources in the description below. And as always, my name is Farouk. I am the host of the Rooks Health Podcast and Rooks Health in general. That's why you can see me here. And I make content around promoting a healthier lifestyle through health and wellness tips and advice, and educating on multiple health topics. Similar thing on the podcast. There's a lot of deep dive conversations on there. But now you know that. Now let's get that out of the way and hop straight into this video on obesity and overweight. What's the difference? Obesity and overweight are normally interchangeable to an extent. Topics, whenever someone says obese or overweight, they normally mix the two of them together. But what's actually the objective difference between these two? Now, we'll start with the definition of what obesity and overweight actually are. Now, according to the NHS, obesity and overweight are terms used to describe or to refer to as excess fat on a body in relation to height or weight. Now, you're wondering, how do we actually calculate this? This is simply done by a formula or tool, you can call it, called BMI. You've probably heard this around here and there. BMI simply stands for body mass index, and it is simple formula, which is your height divided by your weight in meters and in kilograms. Now, obviously, but BMI is not the most perfect tool. It has its flaw. One of its major drawbacks is it doesn't account for significant muscle mass to an extent. So someone who is more muscular but has low body fat may be showing up as obese or overweight just because they're more muscular. So according to NHS, there's a recommended in the guidelines, which is also in the description, is to use waist circumference. So say waist circumference, actually. Waist circumference to alongside BMI, but we won't get too much into that because that's not the essence of this video. Okay, so now we know what the definition of overweight and obese are. We know definition of what BMI stands for. Now let's get into the ranges, because this is the objective part that actually tells us the difference between the two. This is what this signifies until it says this is overweight, this is obese, this is morbidly obese. So ideal weight would be 20 to 25. Overweight starts on 25 to 29.9 if we're being very specific. Actually, obese starts from 30 to 40, and then above 40 is considered morbidly obese. That's actually the objective markers that we use. Now, it varies different places. I don't know if different countries might use different markers, but in the UK, that's the markers we tend to use as to be objective, to be able to determine one or the other. And there's also the eyeball tests, which is very subjective. Hence why you normally use this in accordance with the objective factors. Okay, so now we have that out of the way. Now let's ask the question, how much of an issue is this actually in the world and the UK in general? So most of this video I'll focus on the UK actually, because that's where I currently base, and that's where most of my practice is done. In the UK, approximately 63% of the population is actually classified as overweight and obese, which is a very high number. 67% of men and then 60% of women are classified as obese or overweight. Now, there can be multiple factors for men and women that can actually show that's why men and women have different times, but we won't get into that because those kind of boil down to lifestyle choices differ between men and women, and also just biology and a lot of different factors that we could do a whole thing of why men are different. But here's something interesting that you'd actually be surprised to know, is that the age ranges at which men and women actually suffer from obesity and overweight actually is different. And now this is because we see in the trend that obesity and overweight tends to increase with age. So therefore, the older population tend to be in this overweight and obese category, as opposed to the younger population. That's almost expected in a sense, just because younger, more active lifestyles, the more older we get, it's a bit more less so. Now, men aged 55 to 64 actually account for about 82% of the overweight and obese category. And for women, it's ages 65 to 74 that account for about 70% of the population of obese women. Now, in the UK, I know I've shoved some statistics in your face, but that's just to give you the context of how well, that's kind of it for the objective side of the fact. However, there are a few more stats I wanted to share with you as well, because in the UK, the trend has actually been increasing over the last couple of years. So we've seen that the obesity and overweight rates have actually gone up, and they've sort of, in a sense, plateaued, but it's not really plateauing, because even if it's plateauing, that's not really a great sign, because it's still at a high number. And we know that obesity and overweight actually impacts significantly health. And we'll talk about this in a second, but it's basically that overweight and obese patients are at higher risks of being hospitalized. Now let's get into the why should you care aspect of this video, which is pretty much, why is this any important? Why am I talking about obesity and all these type of things? Now, the reason I'm talking about this is because over 700,000 people are admitted yearly into the hospitals due to primary or secondary reasons for obesity, which generally basically means that they went into the hospital with either their first concern being directly an indication of being overweight or obese, or that was found to be the second thing. And they found that the second thing was, okay, this is your first problem, but then also your weight is actually playing a role into your admission as well. Now, some of the most common pathologies or sicknesses that you can say are things like knee joint pains, heart issues, a lot of respiratory cases as well, and also some maternal issues. Those are the primary causes where someone comes in with one of those things, and then they find that the weight actually plays a role as well into kind of aggravating but making it worse, those conditions. And then there's a second part, which is the risks associated with being overweight or obese, are things like diabetes, type 2 diabetes actually. Some types of cancers are actually very, very prevalent in that category. There's also no joint pain, so a lot of joints in like the hips and knees, because those are the primary load-bearing joints. They take a lot of weight through those joints. And to an extent, ankles as well also are prevalent as well. And one area which is often overlooked are these psychological effects and psychological health of a patient or a person who's struggling with overweight. And that's actually often overlooked, but I won't get too much into that because I do cover that aspect in a separate podcast episode, and I'll put that in the link below so you can check that episode out as well. Now, let's get into the causes of obesity. Now, the causes are, in a sense, simple and complex at the same time, because it's simple in the sense that one of the primary causes is lifestyle choices, in a sense, nutrition, dieting, feeding, exercise. And we know that lack of physical activity or lack of physical exercise is a very big factor. Eating processed foods, high in sugar, high in, generally not good stuff for your stomach. Again, I won't go too much into that detail, into those type of things, because I covered that in the whole podcast episode. But it's things like this, like it's a varying category that causes obesity, and it doesn't happen in overnight. It's all these things accumulated over a long period of time. That's what actually causes this thing like overweight, and that's how we can easily pick up weight and things like this. So now let's get into the treatments for obesity and or overweight or anything like this. Now, to be very honest, if you look at the NHS website, it even says it is not an easy journey, because it is long and it is tedious, but it is very much worth it when you're considering your health. Now, each person's health is very individualized to you. It's very specific to you. But however, this process of losing weight, there is no quick pills or anything like this. And you probably see a lot of the time things like lose weight in 1 month, no dieting, no exercise. I am always very wary of those. I'm very, very suspicious, because I don't know what they're doing. I don't even tend to go into that, because I know that the healthiest way, both short-term and long-term, to actually lose weight is through exercise, nutrition, and things like this. Those are what tend to be the safer ways. Now, again, there are a lot of resources. The NHS has a Couch to 5K plan, which I put in the description, is very good if you want to just start getting more active. And I also link some other articles I've done, as well as podcast episodes, that you can actually have a look around to see how to actually lose weight. But however, it's not an easy journey, and that's where it often scares people away. Now, the 3 ways which I tend to look at it and how to actually treat it, or how to look at it, is, first one is, it's not an easy journey. It's recognizing that it's going to be work, but willing to put in that work, which is very consistent work, which is the most important thing, consistency, because without consistency, it just becomes a fight, a downhill battle or an uphill battle, either one, because you're fighting and you get to a point and then you come down and then you get back up, then you come down. So consistently working through it is the most important thing if you are trying to lose weight or you're struggling with your weight. Now, the second part is having a good supportive system, which is pretty much the sense of having good people around you who can actually support your journey. And if you are someone who knows someone else and they've come to you for advice, it's very important that we actually help as opposed to bringing down. And I'll do a whole segment later on, body shaming and body positivity. And we'll talk about that later. But being supportive is just the most important thing. It can be the smallest of things or it can be the most complex of things. Just be supportive. And that's the best way to go about it. If you're trying to help someone, even if you know you cannot do it yourself, you can direct to resources. You can direct to people who know a lot more and who are more qualified to actually help. And the third one actually is taking it step by step. Often we try and, jump the gun in a sense and try and do too much within a little amount of time, but don't appreciate that it's very cliche, but it's a marathon, not a sprint. But it takes a lot of time and it takes a road, but doing it little by little, setting little achievements for yourself is one of the best ways to actually go about it, because this shows that when you can get if your aim ultimately, for example, is to lose 50 kg, if you shorten that into little blocks, it really makes it more achievable and it doesn't make it so much of a giant hill to overcome. Because if you can imagine trying to lose 50 kg, sounds already daunting, but if you put that into perspective and say, I want to lose 5 kg this month or 5 kg this month or in 2 months, that becomes a lot more realistic. And you say, well, I can do that a lot. Then when you hit that 5k, then you say, I've actually lost 5 kg. And then you can say, okay, let's push it up again to another 5 and let's do it like that. And before you know it, honestly, time flies. It's very hard to start things like this. The first 2 weeks are always going to be one of the most difficult times for any change in plans or anything like this. But after 2 weeks, after 3 weeks, after 4 weeks, your body gets used to it and you get used to it to the point where if you stop, it becomes kind of a weird sensation to your body or yourself. You're like, I've already been getting into this groove. But once you can overcome that initial, overcome that initial phase, it becomes kind of downhill from there in a sense. And it becomes a lot easier. Now, obviously, this is just a kind of an introductory video. I wanted to give the objective aspects first. It's not so much objective, but in the coming weeks on my podcast, on the Rooks Health Podcast, we will be going through more things like this. So I strongly recommend you check out the podcast. You can find it on anywhere and follow us on social media. I say us, but it's me at Rooks Health. I'll put that somewhere here. And while you're here, you might as well check out some other podcast videos as well as some other videos I've done on the channel. Until next time on Rooks Health.